As we step into the new year, it's the perfect time to talk about resolutions, specifically dental health resolutions. Today, we're joined again by Dr. Mandeep Johal for our Smile Spectrum segment. And we're not just talking about the usual brushing and flossing, we're diving into how dental health ties into our overall well being, exploring cosmetic dentistry options, and even how our dental health can impact our posture and gym routines. Let's kickstart the new year with a dazzling dental routine. Welcome, Dr. Johal.
Happy New Year, Candace, and thank you for having me again.
So, as we've made our New Year's resolutions, why is it important to include dental health and how does it connect to our overall well being?
Well, one thing is just coming off from the holidays, we've pretty much lost our dental routine for most of us. So just kind of getting back onto that, getting our gums and our teeth back into shape. But really, it's just the basic stuff, right? But I really do want to dive into the other stuff that you had touched because that's something that we don't really talk about. But just get back into it, make sure dental appointments are made so we can maintain better oral health.
All right. Well, let's get into the big one because I think a lot of people listening, a lot of women specifically, cosmetic dentistry is often thought for a fresh start. So, can you discuss some traditional options and perhaps some unique approaches that people might not be aware of?
Yeah, well, like from a holistic, more natural point, I always like something that's a little bit more non-invasive first. So I always say start with a dental cleaning, or start with even something if you don't like your teeth are, maybe misaligned, you have a little bit of crowding. Start with even clear liners because they're not invasive. It's very simple and easy to do. Even teeth whitening is a great option. But there's also there's another option that's very minimally invasive, which is like minimal prep veneer. That means that your dentist will just maybe remove just a little bit of enamel and then be able to put these nice little thin porcelain caps over them to give you like that nice straight teeth or different change of color that you may be looking for. So it's not an option for everybody, but I would always definitely try to see if we can do that. Another thing that we do for patients that's minimally invasive is we do what's called a composite veneers, which is just the regular white filling that you use. And we can just build up your teeth, different colors and shapes, which is something so simple and very non-invasive. And then you have the other ones where people want like full veneers, where they might have to really prep the teeth, or full crowns you might have heard of, where they really shave down the teeth. And I don't really advise it unless it's really needed. I would try everything else before you go to something that really shaves down your teeth, right? You can't get that back.
Yeah. And so, for people who've maybe lost some enamel, a veneer would be very helpful.
Yeah, like we're talking about just the front teeth for sure. Like we could do that for the front teeth.
So many of us who start the gym, obviously, many of us hit the gym as part of our New Year's resolutions. So how does our dental health, particularly when it comes to our posture, you often bring things that I think are not related, but I'm sure you're going to explain. So how is this all related with gym injuries?
I know. So, okay. So the new year and everybody's put on a little extra weight. And the first thing we'll do is like, well, I'll just jump right and go straight to the gym to start losing that few extra pounds we want to lose. But what ends up happening is we have malocclusion, meaning our bite is in the right place or our jaw isn't in the right place. And you start lifting the heavy weight, or you start running for long periods of time. You start putting a lot of strain on your neck and your back. And next thing you know, you've pulled your back, or you pulled your knee, or you pulled something in your shoulder. But having proper posture, which an airway or a dentist can help you with, will help alleviate that. Like I have so many testimonials now and patients that attest to it that they can actually lift heavier weights with a positional appliance that I can give them. And they're like, how is this possible? I'm like, it is. Your body has more strength when it's in the correct posture, as opposed to having like, if you had like a jaw that's further back or your teeth are kind of like on a slant like this, that's called malocclusion. That puts a lot of pressure on your jaw joint, and it also causes what's called forward head posture, right? So forward head posture, you're going to be prone to some type of injury for sure. So yeah, talk to your functional dentist about what they can do to help you. A simple little appliance can change it so much, and prevent those injuries.
And you've mentioned nasal breathing as a unique approach in cosmetic dentistry for anti-aging, which I am particularly interested in. So fill me in, sister.
We all want to slow how we age, right? So the more mouth breathing we do, and they've done numerous studies, okay? They've done numerous studies where they've literally taken monkeys and they blocked their nasal passages. And just in a short span, they've seen huge changes in their faces. So think about us as humans. If and especially adults, we see it in children all the time, but even for grown adults, it's going to change the way our face is aging because mouth breathing literally changes our actual physical structure. So you can get fillers and Botox, to kind of do the padding. But what I'm trying to do is help you change or even maintain the structure that you already have, like the high cheekbones or the upper lip support. So you don't need, people are getting like lip lifts done and fillers in their cheeks. But if you have the bony structure underneath to support it, you might not need it as frequently, or you may not need it as early as you think you would. So yeah, I'm a big component of nasal breathing, starting with babies to children. It literally changes your face. It's changed my face, the way my tongue works. My swallows completely changed. Even helping with double chins. That's a big thing for a lot of women. They struggle with the turkey neck and the double chin. But I do have lots of stuff on my Instagram, and I have a reel that shows my changes from where my jaw used to be further back 13 years ago. And then just recently I did my treatment to bring this jaw forward and help eliminate the double chin. I didn't really have a double chin 13 years ago, but you could start seeing that it would have led to that because the chin and the jaw were so further back, like we're pretty retruded further back. And by bringing the lower jaw forward and toning the base, getting the tongue on the roof of the mouth, and nasal breathing has completely changed my face.
Well, me and my double chins, thank you for this information. But I'm grateful to know that there is hope out there for me, particularly as I've been aging. I keep thinking, where is this chin coming from? I wish it would just leave me alone.
It's all posture and get that tongue on the roof of the mouth. And you know what? The other thing is really going to help you with nasal breathing and tongue posture is going to be sleep. So the older we're getting, right? Now getting off the holidays from the lack of sleep and all the alcohol, when we hit that certain age, our body doesn't rebound or lose weight the way it used to in its early 30s or 20s. Getting that sleep, optimizing that nasal breathing is going to help you shed that weight so much quicker. Right. So, I mean, I hope this was helpful because it's helped and changed my life and many of my patients' lives.
Absolutely. Amazing, solid information as usual. Where can people keep up with you and connect with you?
My Instagram is actually great. It's wealth of information. It's Dr. Mandeep Johal. And yeah, you guys can DM me, but there's just so much information on there about nasal breathing, sleep, hormones, vitamin D3. That's all plays a role in. So lots of good stuff to help you start the new year right.
All right. Incredible. Thank you for joining me today.
Thank you so much for having me.